In thinking about how we wanted to address this, right? We wanted to let you see what Confirm Med and our specialists do around direct questions related to women's health, typically in the field of OBGYN. But I do want to lead by saying we do get e-consults in all of the specialties that may ask very focused questions about the woman perspective of the illness and the care in cardiology. Really typical for our cardiologists to see questions about diagnosing signs and symptoms related that, some cardiac issues, lipid issues with them that they handle that may bring in guidelines that might be a little different. That happens every day in e-consults, as well as an area that's important is in behavioral health and psychiatry. We'll have primary care providers that are doing women's health care, and they may ask, I have a woman who is thinking about pregnancy. She's on Zoloft. How do I manage that? That is a really common e-consult type of question that comes in around psychiatric medications. But how we're going to talk today is on these true consults that come in related to what we think of on our side as OBGYN care. So across the board at Confirm Med, we've done about 450 e-consults related to that. And in terms of 60,000 e-consults for us, that's not many, but there's a few reasons for that based on geography and who provides well woman care, pre-pregnancy care, all of those pieces. There's some practices and there's some geographies where that is really done within primary care, within FQHCs, and there's others that just it's not. It's typically done outside. So we see it both ways, but we're supporting many practices in California that do a lot of this inside, and they don't have midwives or OBGYNs on staff. So we're really supporting them around getting them information to grow their knowledge to do this. So one of the important things we always talk with practices about, so for when you submit e-consults on women's health issues, almost 86% of them are, you can keep this in primary care management. This is within your realm. Let me help you get there. So that's wonderful. And these are who are asking the questions. It's across the board. It's the MDDOs are half and the MPPAs are the other half. So it's equal that we're servicing. And I think that's important to see, because sometimes there can be this assumption that they're all coming from nurse practitioners and PAs, and that's not the case. And what I'd like to do now is Dr. Anderson is going to walk you through some of our e-consult questions that we get, and here are the typical high level, like if we were to sort all of the questions we had in the last year, this is what we're dealing with across there. So Darren, would you like to take over?
Yeah, no, I would. Thanks. And Libby, thanks for inviting us to present on this topic. And I'm going to do in a second what I like to do often when we have calls like this and a widespread of attendees is to really ground ourselves in some actual consults. I think we could spend all day talking about integration and talking about rules and things for how to use e-consults. But I think when you see real consults and the types of things that primary care providers are asking and the types of responses that they're getting, it really helps to ground us in the reality of what we're trying to do. And I'm the president and founder of Confirm Med. I was a FQHC primary care provider. I'm an internist going back for a long time now. And one of the things I like to do in this role is to read consults. I look at lots of consults. I look at all of the new consults when we have new providers joining, when we have a new health center. And it always amazes me, to see, I think it's fair to say there's two reasons why practices, and they're overlapping reasons why practices are using e-consults for women's health and other things. One of them is the extreme limitation to access. You have a question, you have a woman with irregular menstrual bleeding, you'd like them to see GYN, you suspect they may need a DNC or something additional workup, but it's 3 months, 6 months, long drive, long wait to get them in. Can I get some advice from a GYN provider about how to start the workup or how to start treatment or how to approach the case? And I call those sort of, well, I'm waiting for the face-to-face. And then, and the others are cases where, women's health is one of those topics that really a good chunk of it falls within the purview of a primary care provider. I did a lot of my own GYN when I was practicing, certainly my own PAPs and basic workups and things like that. But yeah, oftentimes it's comforting and helpful to have a specialist, say, in your back pocket to confer with, to get some advice and guidance about what you're doing if it's not something that you're seeing as commonly as like type 2 diabetes. And then I think increasingly the other reason we're seeing primary care providers use e-consults is, one of the compelling stats about the United States is how little we spend as a society on primary care and how little we utilize primary care compared to specialty care and hospital medicine. I mean, the US spends between 5 and 6% of its total healthcare spend on us as primary care providers. All of the other modern advanced economies spend 14% or more. And there's really is, I think, more than the beginning, but really an advancing movement across the US and a realization that needs to change. We need to empower our primary care providers to be able to do more, and we need to spend more on primary care and focus on it more. And in taking on more and relying less on specialists, which is a big part of that, having access to a specialist to give you advice and guidance through an electronic exchange like we do is really, really helpful in implementing and expanding into what's called advanced primary care. So let me show you some examples of how this fits into, and then I'm gonna read through some of these, and because I think when I think about women's health or when I think about GI, I immediately jump to all of the things that you couldn't use an e-consult for. If I have a lower GI bleeding, they're going to need a colonoscopy. I can't do any consult with that. In GYN, many of the referrals that we make are require procedures or at least a pelvic exam from a GYN. But I've been surprised in looking at our examples of how many times that's not the case. How many questions come up from our PCPs that are perfectly appropriate for an e-consult, perfectly appropriate for primary care nurse practitioner or MD to manage, and how the guidance of a GYN specialist can help. And so we're going to show you a couple of those just to get the juices flowing and to get a feel for what some of these are. And so this one you can see, I'll kind of paraphrase some of these, but this is a 15-year-old girl or woman with Implanon that she's had, and for birth control and for irregular periods. And as you can see, she's been developing irregular bleeding. And this is an example of what I would describe a really good e-consult question. A lot of times we talk about what PCPs can do to get a good e-consult. And this is an example of exactly that. Very simple, stated couple of lines, but I started on a course of OCPs back in January to see if the bleeding stopped. And she's now been on that for 4 months and is trying to taper off without success. Question, what is your recommendation regarding breakthrough bleeding on Implanon? Should it be taken out? What is your common dosing recommendation for an OCP to stop the bleeding? And says, I ordered a pelvic ultrasound. Was this overkill or not? And so I would highlight this for 2 reasons. One, it's a great example of an appropriate e-consult that can help a PCP keep something within primary care that appropriately can be managed there while getting the benefit of an expert specialist to give advice. And 2, because this is an example of a perfect e-consult question. If you want to get the most out of your e-consult, since the consultant doesn't have the benefit of being able to talk to the patient, this is how you do it. And you can see, I won't read it. It's been up long enough. Hopefully those of you have had a chance to skim through it. But you can see nice, simple, succinct response recommending estradiol, milligram a day for 30 days. And also kind of reassuring or validating what the PCP was experiencing, that breakthrough bleeding is common with Nexplanon, and the ultrasound was fine. As you said, it wasn't overkill to do that. So often the consults will include a little bit of what I call a reassurance consult, like you're on the right track, you're absolutely right. And you can see with this case how this is, I think, a great example of avoiding what otherwise would have been a face-to-face referral to a high-price specialist, probably a long wait, or at least a decent wait, and how it provides information that not only helped with this specific case, but will assist this PCP the next time this same case comes in. The case that was being presented here is not an uncommon problem that a primary care provider will be asked to tangle. And so in so doing, you're providing quick, rapid, efficient expertise and treatment for a patient, and you're empowering a PCP to become an advanced primary care provider for the next cases that they'll see. We can go on to the next one. And again, one of the things I think to see about this one is PCPs often, one of the negatives that we hear about implementing e-consults is they can represent more work. It's more work. I got to type up this question, and then I got to do all these things. And I'm not going to lie, sometimes that is true. What used to be something you would send out to a cardiologist, now you need to read their advice and you need to implement it yourself. And that does happen sometimes. But for every one of those, there's cases where it's probably just making your life easier by getting an answer to a question and getting your treatment implemented and getting on with life. And I think this is a good example of that. And also a case where it's helpful to get advice and guidance from a specialist that you can now take back and reassure your patient or use to bolster your conversation with the patient by saying something along the lines of, I discussed your case, I presented what we talked about, I shared your data with a specialist, and here's what we think is best. And this is a case, 24-year-old female with low sex drive who probably saw on television or read in a magazine something about a new medication and requested hormone levels for the workup. And reluctantly, I agreed, as the PCP says, and is asking for some advice. And a nice, again, these are brief, very bulleted, simple response back about the perils or the challenges of interpreting an LH-FSH level, as you can see. And some very basic education and recommendations for how to approach a patient who's complaining of low sex drive, and advising against using medication except as a last resort after other conditions have been really thought through. And this, you can imagine, sort of going back and using this consult in your discussion with this patient to educate them and to reassure them and to guide them as you begin considering some of the other more likely possibilities in working this up. You can go on to the next one. Okay, so another one. This is again a really common case, scenario that a PCP is very likely to encounter. 19-year-old with abnormal irregular periods for a few years with possibly some hirsutism and some non-specific symptoms, weight gain, asking, again, a great question, very, very focused and clear. What kind of symptoms are more notable for polycystic ovarian syndrome that warrant screening? So asking for guidance about something that I know primary care providers we see on a very regular basis and an increasing basis, concern about possibility of PCOS and insulin resistance and all the things that go with that. I've ordered a TSH, LH, FSH, testosterone, essentially, what else should I do? And you can see here, again, the specialist has given fairly straightforward, simple recommendations for how to approach it and advise the patient or the provider for next steps. And I think we have one more. Okay, so 41-year-old female with a history of ovarian cysts, now asymptomatic, had menarche at age 13. 3 months ago, started to have irregular menses, once every 2 to 3 months. And over this past year, started to have hot flashes as well. I'm sorry, it's a 41-year-old female. I think I misread that. She had a tubal occlusion, has not been sexually active for 3 years. She also had thyroid testing done. Does she require any workup? Again, this is a really good example of how e-consults can help. If you didn't know the answer to this, you would send the patient for further workup and result in probably what our specialist might say is an unnecessary referral. And I hate that phrase because from my perspective as a PCP, if I'm not sure and I need a specialist, that's an appropriate referral. But what you get instead in this case, again, a very simple, I think the brevity of these responses in some ways is reassuring. In that some of these are simple questions with simple answers. No further workup is needed since she's likely in the perimenopausal transition state. However, she'll need endometrial biopsy if she starts bleeding heavily, and gives clearly what are the criteria for when I would want to consider that. But for now, there's nothing to do. And I have to say, I love it showing consults like this to health plan members and anyone concerned about the overall cost of care, because you can see in just in a simple transaction like this how unnecessary healthcare spending was avoided, and also, how patients' lives are made more convenient and easy. So instead of this person having to take time off from work and having to drive to the university or wherever she would have to go to get a women's health evaluation, to be told essentially there's nothing more to do, you just took care of this in the space of a couple of hours. And so, the efficiency of this communication tool and the different ways it can be applied. We could throw up some dermatology examples and show how pictures of rashes and things are being used the same way. The ability to make our care more efficient and to strengthen what we can do as primary care providers, I think really shines through in each of these examples. So I'll end with that and see if there's, I don't think there's another one. I think we had 4, right? Yep. Great. And so happy for any of us on the team to take any questions from anyone. And Libby, thanks for inviting us onto the call today.
Thank you, Dr. Anderson. Folks who are on audio are welcome to unmute, ask a question. If you are in a place where it's easier to send a chat, you're welcome to do that. I'll give people a moment to share any questions they may have. And I also wanted to welcome, we have Dr. Beth Stewart, who's Medical Director at Anthem, joining us today. And Dr. Stewart, I welcome you to make any comments, observations, and what you've seen in terms of the efficacy of eConsult here.
Yeah, thanks, Libby. Hey, everybody, it's my first time joining this meeting. I was really happy to get to join today. I actually loved those examples because seeing the actual clinical examples of the different types of e-consults and questions that can be answered really do help bring it to life. But I'm just excited about e-consults in general because they're another great tool that we can use, to help patients reduce barriers, to high quality and timely subspecialty care. And I think the benefits for the patient are so obvious, right? Like not needing to wait for a long period for appointments, not needing to travel to the appointments, which can be a really big deal in terms of people who are live in more rural areas or have other SDOH type barriers to accessing care, and can get guidance more quickly for their condition. So I'm excited about that piece of it, like getting care more quickly and the part of it that can help reduce barriers, especially, we're all kind of hoping the pandemic would be over by now. It's not, but, a lot of these equity issues have really been brought to light by the pandemic, and also just people's comfort during the pandemic of seeking care in person. So just like another tool, to bring care to patients, especially who might face greater disparities, doing it in a way they're comfortable with and in a timely manner. So yeah, I'm excited to be a part of this discussion today. Nice to meet everybody.
Thank you so much, Dr. Stewart. It's really good to get a clinical perspective on this. Many of us have been doing this for years, and I always love seeing the case examples because it makes me think about, as I'm a patient, I'm not a provider, how might I perceive this? And one of the questions I had for Dr. Anderson is in cases like this where, well, all care is sensitive, but when you have sensitive topics like women's sexual health, do you have any good advice for primary care providers? If they have a question that is going to require communication with the patient with regard to the specialist response, how do you help primary care providers talk to patients about these issues, make sure that they get the information that they need, since some of it is some of it's going to be requiring conversation on the phone with the patient perhaps, or another a follow-up. But Dr. Anderson or Marion, do you have any advice with that?
Yeah, I mean, I'm heavily biased as a primary care provider, and I happen to, and I believe, in my heart that is what we do best. That's why we went into primary care, is because we want to maintain relationships with our patients. We're good at communicating complex topics. We go to places like community health centers because we want to serve people that otherwise have difficulty getting access to care. And we build community health centers that specialize in addressing social determinants of health and communicating to patients, in a language and with a level of respect that they deserve, regardless of the station. And so I want to be the one, and I want to empower primary care providers to have those sensitive, delicate questions. I think, but to me, it seems a whole lot worse to have a sensitive conversation with the PCP and then go repeat the whole darn thing to a specialist who I've never met. So I think in large, and in that case, obviously the PCP has already had the delicate conversation, about sex drive or whatever. And to then be able to say, this is what I think, and we have a telehealth system that allows me to run your case by another specialist and get some input and advice. I'm going to do that and get back in touch with you so that we can talk about what they, what they recommend. I think what that says to me, and I think says to the patient, is we have tools to be able to provide even more care in your community, in your primary care medical home, with all of those tools, probably through the language line or speaking your language as well if they don't speak English. So, I use it as a positive way to keep more of your care in this place that does it the best in terms of communicating and working with patients, particularly in FQHCs.
Thank you. And Marianne, I welcome you to pipe in too on these questions too, but I did see another question come in that is sort of along the same lines of communication from Stephanie Fluitt. And interestingly, our next session is on best practices for communications. How do you write good questions as a primary care provider? How do you elicit a good response? And Stephanie's question is, what do you find is the best way to influence PCPs to write good clinical questions like these examples, rather than avoiding extra work of just saying evaluate and treat or see notes? And we do hear that a lot. So Marianne and Darren, go ahead.
Yeah, we do. We hear it a lot. We see it a lot, and it's. And I'm going to try not to go on and on. It's a very complicated question, because it really what it gets at is the answer is you need your primary care providers to want an e-consult and to expect an e-consult. If they expect one, and they want one, and they buy into it and recognize it as a tool that can help them, they will. The PCPs who you saw, the examples that we shared, clearly were looking for an e-consult, expecting an e-consult, and wanting one. And getting your PCP staff to that point is an enormous challenge. You'll always, just human beings being who they are, you'll have your early adopters who are gung-ho and want to do this. You'll increasingly have newer trainees who experienced it if they were at UCSF or wherever they came from medical school, and will be wanting it. And then you're going to have a variety of other responses to something that's new and different. And I think that's the biggest challenge for e-consults, is it's new and different. It's not the way we used to do things. It's a different process, and the real answer to this lies in change management. You need, one of the things we've learned, I think, the hard way, is it's not enough to throw the switch and expect it to just work. It has to be managed. It has to be managed as a change man. If you're implementing a new electronic health record, you would have a whole team managing that change process and getting people fired up, and you'd have posters on the wall and things, whatever. You'd have metrics, and you'd be tracking progress and all that. You have to do that for e-consults too. The health center team, the medical director in particular, needs to advocate this. They need to champion it. They need to bring on early adopters as champions. They need to talk about it at each session, share graphs of who's using it and who's not, build up a little internal competition. All of those sort of soft things that we do. Anyone who's ever taken sort of a change management, quality improvement type of a course will be familiar with those types of tools. They're critical. And if you don't do that, if you just kind of throw the switch and say, well, guess what? Not that you do that, but if you don't do those things, either it comes as a surprise because PCPs they didn't realize they were doing it, or maybe they heard about it and forgot about it, or they will not have bought into the idea and be less, more reluctant to really jump in and contribute a good question like that. Because you can not that you should, but you can write a eval and treat, send it to the specialist, and they will be able to talk to the patient and figure out what you're sending them for. I would not advocate for that, and I would criticize somebody if that's all that they did. But nonetheless, it's easier to get away with it when you're sending them to somebody else than when you're doing an e-consult, where that really makes it hard for the specialist to figure out what the heck you're trying to do.
I agree with everything you were saying, and also just wanted to mention, like, in the same way that a picture is worth 1,000 words, right? Just having those few examples for people to see, and like kind of making that connection, right? Like, oh, I've had that patient, I could have benefited from this, or even just, what the top types of e-consults that are done are, really get people to make that connection.
Yeah, I completely agree. We have a booklet that we put together that has 2 or 3 examples from every one of our major specialties and shows those. And it's intended for 2 things. One, to help people start thinking about how they might be useful. If they, like with GI, most people say I would never use it for GI. Well, you'd be surprised how many H. pylori related treatment questions we get that are perfectly well managed as an e-consult, and it helps to get the juices flowing. It also shows examples of good questions, so you can start thinking and framing up how you might submit your questions and to the best advantage.
I'm sorry, I shouldn't laugh when it's GI and you say get the juices flowing, but the point that I want to make here is that with the examples that you gathered, working with Dr. Walensky, who will be presenting on April 22nd, you have, we're making the session specifically focused around that, how to write good questions, since we've heard that a lot. And this one happens to be focused on pediatrics coming up, but the skill of writing questions, or the best practices in actually writing the questions, will be the focus too. So with that, I want to make sure we get any other questions from the audience. Any other questions for Dr. Anderson or Marianne? Marianne, did you have any words in closing?
Yeah, I think you're muted, but I think you just said nope.
Okay, great. Thanks so much.
I translate for Marianne, which is off mute.
Thank you. Thank you. I'm good. Thank you, Libby.
Yeah, this has been really great. It's always great to see these really detailed examples you as ConfirmEd provide. So thanks to you both for your time. And with that, we're just going to share a few tools for those of you who are new to our group. We've worked together over the past couple of years to think about what we can put in front of patients. If primary care providers have that opportunity to talk to patients about e-consult. Some of the clinics said, how can I, do you have something I can leave behind? Can I hand something to a patient just explaining what this is? So we put together with help from ConfirmEd and others who helped us think about what do patients want to read or understand, what would they understand when we talk about e-consult. We tried to put together a very simple tool. We know our patients speak many different languages, so we want to make this simple and easily understood. The big takeaways for us with regard to e-consult, especially in North Rural and Central, are that patients, if they're aware they're getting an e-consult, can be told that we hope that we can avoid some unnecessary travel in this process, unnecessary time off work. But we also want to emphasize that it's in the primary care team's job to communicate that the e-consult's happening, and that after it takes place, if that primary care provider gets the feedback from the specialist that the patient needs to be seen, that the patient will get communication through the clinic to know what's happening. So we're making sure that we understand that there's a closed loop to this process. The patient referral won't just sit out there and remain unanswered. So just a quick tool that we can make sure that you have if this is helpful to your clinic. And I mentioned our upcoming CME. I put the link in the chat if you or your colleagues are interested in the April 22nd session. This is actually open to anyone who's interested in e-consult and PEDS can join. As we talked about before, also focus on how to write good questions for e-consult. So this is going to be not only hosted with providers from ConfirmEd, Dr. Dan Walensky, but Dr. Young from Valley Children's. We're really pleased to have Valley Children's Hospital responding to e-consults, and they're happy to help to make this process a little bit better. So please take a look at that, put it on your calendar, share it with your primary care providers or specialists who might be interested in continuing medical education credit. So as part of our e-consult coalition, we like to provide opportunities for physicians, for clinicians, to really make the most of their time. We understand time is short. So if we can offer continuing medical education units to those providers, we want to do that. So our next session is CME eligible. All the providers need to do is complete a quick survey at the end of their session, and they get the units for the CME. So that link's in your chat. Thanks for sharing it. We also want to note that our coalition, our project is open to any stakeholders who are interested in attending our monthly calls. But we do encourage not only the clinics who have primary care teams to get involved, but we also welcome specialists to get involved. I just mentioned Valley Children's. We're so pleased to have them participating as a specialty group answering e-consults. We welcome others too. We know that there are other specialists across Central Valley who've expressed interest. Just reminding providers that this has been going on for many, many years across the country. It's and it does require a little bit of an explanation and education for providers to understand how it all works. However, we now see that it's really become an integral part of the referral workflow across California providers. We've seen great impact in reducing patient travel, even more important now with our gas prices skyrocketing, as you all know. Through our program, obviously, we've seen those that such a high percentage of the e-consults are resolved without the need for a face-to-face visit, which means that patients have to wait less time to get that specialty advice. We obviously, through these more efficient or streamlined way to get that advice, we see cost avoidance and the optimization of your local specialist's time. We know that specialists are in short supply, those who see our patients locally. So we're just pleased to see that through access to remote providers, we can use those local providers in the best way possible. And we, as you may know, if you were involved in our group last year, we really worked to promote e-consult coverage for primary care. So there was a state bill that made it all the way to the very end, unfortunately was vetoed late last year, to support primary care provider reimbursement. We know that that's important, and we're going to continue to work toward that. We know specialists are reimbursed for e-consults, and we would like to see primary care providers reimbursed too. So we're going to continue with that effort in the next year, working with Department of Healthcare Services and Department of Managed Healthcare toward that. So welcome any questions in the chat, or you're welcome to take yourself off mute if you have any questions around that too. Last, for those of you who are new to our group today, we have our North Rural eConsult Coalition and our Central Valley Coalition. We're going to continue to meet throughout the year. We would love to see new people join this, especially those who are clinicians who might participate in eConsult, or referral team members who are so integral to the eConsult process. If you're on today for the first time and you know that your teams, your primary care team should get involved, please share this information with them. We'd love to have you delegate those participants who have their hands in the eConsult process. We encourage your referral partners to participate too. We have CME coming up. We'll continue doing other CME opportunities throughout the year. If you do see problems, if you do notice that there is a specialty that is hard to access in your region, we like to be able to focus on that. So Marianne mentioned we did a pain management eConsult CME back a year ago. We did one focused on child psych access with Dr. Steinbushel earlier this year. Our next one is on PEDS. We'll continue to focus on those high need specialties through our CME courses. And thanks for explaining your patients, or explaining to your patients, what eConsult is when you have the opportunity. And we welcome new members. You have, I'll put my email address in case you don't have it handy, but please do share those new team members' contact information with me, and I'll make sure that they get our invitations and our newsletters. Here are links to our resources. I'll put these in the chat too. There is a website specific to our Central Valley and North Rural coalitions that has our recordings on it. It has past presentation materials, upcoming meeting dates. So you can always go to these websites in order to find out what's happening with your specific coalition. And our econsultworkgroup.com website is where we house research. You'll notice a great amount of research from Dr. Anderson and others who have published over the past few years on the impact of eConsult. We have our monthly newsletters, and you can see here also a playbook to eConsult to show different examples of how it's used across the country, and actually internationally. We see a lot happening out of Canada too. So with that, I think we're going to wrap up a little bit early here. Make sure that those links are in the chat. You can share any questions with me. My email and contact information are here. I will give an opportunity for comments as we wrap up. I'm not sure if our Anthem or California Health and Wellness leads would like to say a few words. Karina, do you want to say anything in closing?
Sure. Yeah. Hi, everyone. This is Karina Mendoza with Anthem Blue Cross. Just like to echo, what Libby was just saying about letting us know who we can engage on the specialty side. Also engage your provider teams, referral teams to join this roundtable and learn more about eConsult. And thank you to all the presenters and attendees for joining today. Thank you.
Thanks, Karina. And we also have Lily Clements from California Health and Wellness HealthNet. Lily, go ahead.
Hi, everybody. Just want to say thank you for attending today's session, and thanks, Libby, for organizing this, and Marianne and Darren for sharing. I feel like I learned the most from all of the e-consult examples that, just coming onto this project a few months ago. So I'm really appreciative of that. And just want to echo Dr. Stewart's sentiments. I really like how you brought up that this tool can really support health equity. So thank you for bringing that up. And just a shout out to our clinics who are currently implementing e-consults. I'm really excited to have you on board and increasing access for our Medi-Cal members. So just thanking everyone today, and hope you have a great weekend.
Thanks so much, Lily and Karina. And thanks to Dr. Anderson and Marianne for presenting, and also to Dr. Stewart for your time today and your insights on eConsult. Everybody have a great weekend. I will leave you with our links in our chat, and thank you for joining today. Bye-bye.